Thank you again for joining us this afternoon. We do have a lot of information to cover today, and I'm going to go ahead and kick things off because, like I said, we've got a tremendous amount of ground to cover today. Why? Because it's one of the recommended topics that our sister network sent our way, and it was a very timely one, especially for this time of year. You have right now, in addition to Pennie's open enrollment, November 1st to January 15th, you have Medicare open enrollment, October 15th to December 7th. And I'm sorry, it's not December 7th, 2022, it's December 7th, 2021, just so that you know. But why that is significant, Medicare open enrollment is a big life transition for a lot of people, including Pennie customers. And what you see here is a representation of what Pennie customers are by age. The 55 to 64 year old bracket represents about 36% of Pennie's 377,000 plus customers. So understand there are a lot of individuals who are in that position where they're transitioning into Medicare for the first time. As a resource, what I'd like to share with you is one that is an absolute favorite of mine, and that is the Medicare You brochure that's put out each year by CMS. It is probably one of the best resources available for individuals like yourself and myself who work with people in the community who have questions about Medicare and how to transition. And I know for many of you, you do in your position as an assister, you work with individuals who are making this transition. But for some folks, especially some of our newer assisters for 2022, aside from the training that they received, this might be a newer subject. So we're going to cover some of the basics today. And that number one starts off with an overview of original Medicare and what original Medicare represents. Now, before we dive into this, please understand, we are going to record this session. We will also make the slide deck available in a PDF version so that you have it if you want to make a reference to it. But to kick things off, original Medicare includes Medicare Part A, and you'll hear an alphabet soup, so to speak, when we start talking about some of these things. Don't glaze over. Don't let me lose you. As we move through this, please stick with us because this is, again, it's something that is near and dear to my heart. I like working with individuals who have questions about Medicare. And in terms of original Medicare, you have Part A, which is hospital insurance. You have Part B, which is medical insurance. You can join a separate Medicare drug plan, which is Part D. And you can use any doctor. And this is the cool thing about original Medicare. You can use any doctor or hospital that takes Medicare anywhere in the U.S., and to help pay for the out-of-pocket expenses like the 20% coinsurance with Medicare, you can also shop for Medicare supplements, or what people refer to often as Medigap. There are gaps in coverage with Medicare that we'll get into here in a minute. And we'll also discuss some of those Medicare supplements that are available to folks. So there are a lot of moving parts when you talk about Medicare. Another important component to consider with regard to Medicare for customers transitioning from Pennie into Medicare is Part C, which is Medicare Advantage. Now, Medicare Advantage plans are, for all intents and purposes, they are bundle plans. They cover or include, I should say, Medicare Part A, Part B. There's generally included a Part D, a drug component that's there, and there's some extra benefits. Now, we're going to talk about these extra benefits a little later on, but they include things like vision, hearing, dental services, things that as you begin to age are very, very important to you. So with regard to that, let's just briefly go over some of the comparisons that that we have between original Medicare and Medicare Advantage, which is Part C. Okay. Remember, in a moment, we're going to talk a little bit more about Medicare supplements. So for right now, we're going to focus on a comparison between original Medicare, Part A, B, and D, and Medicare Part C to see where for some customers the true advantage might lie. With original Medicare, again, you can go to any doctor or hospital that takes Medicare anywhere in the United States. That's a beautiful thing for a lot of people. Now, just like an HMO or an EPO, Medicare Advantage provides, it provides you robust care, but you'll need to only use doctors and other providers who are in the plan's network. So it's very, very important that an individual considering Medicare Advantage plan work with someone to help determine whether or not their key health insurance providers, their family physicians, the hospitals they like working with are included in that plan. Now, again, under original Medicare, in most cases, you don't need a referral under original Medicare. Now, again, just like an HMO or an EPO, Medicare Advantage, you're going to want to have that referral within the network so that your coverage is included. And, again, for many people, having access to those organizations is very, very simple. There are a lot of good health systems here in the Commonwealth of Pennsylvania. In terms of cost, under original Medicare, for Part B covered services, you usually pay 20% of the Medicare approved amount after you meet your deductibles. And this is what's called coinsurance. Many of you are familiar with coinsurance, but this is where, in Medicare terms, this is where it comes through. You also have, under Medicare Advantage Part C, out-of-pocket costs tend to vary. Plans may have different out-of-pocket costs depending upon the insurance carrier and the market you live in. Under original Medicare, you pay a premium, a monthly payment for Part B. If you choose to join a Medicare drug plan, Part D, you may pay a separate premium for that Part D. Here's the thing, under the Medicare Advantage, again, that's a bundle plan. You may pay the monthly Part B premium, and you may also pay the plan's premium. Plans may have a $0 premium and may help you pay all or part of your Part B premium. Most plans, and this is the important thing, most Medicare Advantage plans include Medicare drug coverage, which is Part D. In terms of original Medicare, there's no yearly limit on what you pay out of pocket unless you have supplemental coverage, Medigap coverage. Plans under Medicare Advantage have a yearly limit on what you pay out of pocket for services for Medicare. Part A and Part B covers. Once you reach the plan limit, you'll pay nothing for services. Part A and B covers the rest of the plan year for you. Again, under original Medicare, you can get Medigap, which we'll take a look at some of the Medicare supplements and the options that are available. here in a moment, but under a Medicare Advantage plan, you don't necessarily need. I mean, you can't buy and you don't need Medigap coverage. Okay, so that's important. In terms of coverage, speaking of coverage, under Original Medicare is going to cover most medically necessary services and supplies in hospitals, doctors' offices, and other healthcare facilities. Original Medicare doesn't cover some benefits like eye exams, dental care, and routine exams. That's something we'll take a look at in a moment. Under a Medicare Advantage plan, plans must cover all of the medically necessary services that Original Medicare covers. And most plans offer some extra benefits that Original Medicare doesn't cover. And that's where you get into routine exams, vision, hearing, and dental services, which as we begin to age, those are services that can make a difference, make a big difference, especially if you're on a fixed income. Under Original Medicare, you can join a separate Medicare drug plan. That's Part D. Okay. Under Medicare Advantage, again, Part D is included in most plans. And then under Original Medicare, in most cases, you don't have to get a service or supply approved ahead of time for Original Medicare to cover it. Under Medicare Advantage, in some cases, you have to get a service or supply approved ahead of time to make sure that it's covered. It's just like receiving that approval from your primary care physician under certain Pennie plans. Now, here's a big thing, because when people retire, a lot of folks want to travel. They want to go visit Egypt. They want to go, see the Great Wall of China, things like that. So for foreign travel, here's the important thing to note about Original Medicare and about Medicare Advantage. Original Medicare generally doesn't cover care outside of the United States, okay? When you take a look at Medicare supplements, and we will hear in a moment, there are certain Medicare supplements out there, certain Medigap plans that will help a person remain protected beyond the borders of the United States. With Medicare Advantage, plans generally don't cover care outside of the U.S. However, it's important to make sure that you review that with the carrier, or that the customer reviews that with the carrier that they're selecting their Medicare Advantage plan from. And here's the thing, through an insurance agent who can provide any of these folks, including us, when you go traveling abroad, an important thing to do is to have a chat with an insurance producer here in Pennsylvania about travel insurance. Travel insurance can really help save the day more often than not. So just file that in the back of your mind. Now, you've heard me mention a couple times that Medicare doesn't cover everything. And as a sisters, I know for a fact that you have had people from the community come to you and say, well, what do I do about dental care? What do I do about eye exams, dentures, cosmetic surgery, hearing aids, long-term care? Now, that's something that a lot of people don't consider, but it's a reality. Here is where Medicare supplements can come to the rescue. Again, with a Medicare Advantage plan, Part C, you've got a bundle plan. And that bundle plan really helps address a lot of the additional things like the vision, the routine exams, the hearing aids, the dental coverage, etc. Well, through Medicare supplements, depending upon the Medigap plan and the option that you choose, you'll have any number of levels of assistance with certain things, and it varies. Part A coinsurance, um, Part B coinsurance or copayment, uh, blood, hospice care, skilled nursing facility care, Part A deductibles, Part B deductibles, excess coverage, and yes, we're back to foreign travel. Some plans and options do cover participants when they are beyond the borders of the United States. I mention all of this because Medigap and Medicare supplements, they can do a lot for you. And here are some things that customers would want to know ahead of time about Medigap or Medicare supplements. Before they buy a Medicare supplement, they have to be enrolled in Part A or Part B. Okay. Um, they need to understand that Medicare supplements are through private insurance companies, and they need to be able to pay a premium for that Medicare supplement, in addition to the Part B premium that they'll pay to Medicare or may pay to Medicare. Also, if they buy a Medicare supplement and a separate Medicare drug plan from the same company, they might end up paying two premium payments per month, one for the Medicare supplement and one for the Medicare drug plan. So it's important that people understand this. And with regard to Medicare supplements, they cover one person. Spouses must buy separate coverage. Okay. Um, in terms of drug coverage, you can't have a Medicare supplement that would cover a drug plan or provide you assistance with a drug plan and have Medicare Part D aside. You have to be able to. You can't be double covered. That's what I'm getting at. So now, in terms of helping customers understand when they can get protected, um, there are some very, very key dates. And to be quite honest with you, these dates, they tend to remain consistent year to year. But when can a person start shopping and comparing plan options? Generally October 1st. They're very good about at medicare.gov/plan-compare. They're good at providing individuals and their assisters or individuals and their brokers with an opportunity to sit down and have a serious conversation about what's changed over the past year. Are there certain needs that you have that your current plans aren't meeting? Generally speaking, that October 1 window provides 15 days where people can start to connect and have that discussion. October 15th to December 7th is generally the Medicare open enrollment period. It's the annual enrollment period. You'll hear people use the term AEP. And for folks, they can change their Medicare health or drug coverage for 2022. They can join, switch, leave a Medicare Advantage plan or a Medicare drug plan during this open enrollment period every year. Now, there's another date that's very important. It's January 1 of 2022. New coverage for the open enrollment period will begin on January 1 of 2022. Okay. Now, there's another important date that coincides with that, and it's for individuals. If you're in a Medicare Advantage plan, Part C, you can change to a different Medicare Advantage plan or switch to original Medicare and join a separate Medicare drug plan once during this time. Any changes you make will be effective for the first month after the plan gets your request. So you have between January 1, or the customer has, between January 1 and March 31st of 2022. Now, there are a few enrollment periods to be aware of, and we're going to go through these quickly. But You have the initial enrollment period when a customer is transitioning from Pennie to Medicare. Here is where the pivot point is. The pivot point is when they turn 65 years of age. In terms of their initial enrollment period, they can first sign up for Part A or B or B during the 7-month period that begins 3 months before the month that they turn 65 and includes the month you turn 65 and ends with the 3 months after you turn 65. More on this here in a little while. There's also an important note here that if you enroll in Part A and or B during the first 3 months of your initial enrollment period, in most cases, your coverage begins the first day of your birthday month. Okay. However, if your birthday is on the first day of the month, your coverage will start on the first day of the prior month. Okay. We'll have some examples on that here in a minute. Another important thing to note, in addition to the initial enrollment period, the IPE, is the SEP for Medicare. And again, this is after the IEP is over. The customer may have a chance to enroll in Medicare during the special enrollment period if they didn't sign up for Part B or Part A, if they have to buy it, when they were first eligible because they have a group health plan coverage based on their current employment. And again, this is your own, a spouse's, a family member's, or if you have a disability, you can enroll in Part A or B. Anytime you're still covered by a group health plan or during the 8-month period that begins the month after your employment ends and coverage ends, whichever happens first. We'll get more to the special enrollment period here in a second. But there's also, again, that general enrollment period. The general enrollment period is that window of time, January 1 to March 31st. And typically, if an individual has to pay for Part A but didn't sign up for it or didn't sign up for Part B, for which they may pay premiums during the initial enrollment period, and they don't qualify for a special enrollment period, they can sign up during the general enrollment period. But here's the catch. The catch is that the coverage, if they sign up January 1 to March 31st, they won't be able to start until July 1 of that year. And they may have to pay higher Part A and or Part B premium for late enrollment. That's an important thing. The contact information and the resource information for CMS is here. It's always good to know that we have individuals within our communities who can really help people in an unbiased way get to the answers that they need. And this is where, again, many of you are familiar with PA Medi. PA Medi is a phenomenal state resource. They're unbiased. They provide assistance to customers who are aging into Medicare throughout the Commonwealth of Pennsylvania. And they can help them with their eligibility, their enrollment, whether or not they have questions related to Part A, B, their Part D, prescription coverage. What's the difference? What will benefit me between a Medigap plan, a Medicare supplement, and a Medicare Advantage plan? They really know their stuff. And again, you'll see here on their website, again, that's PA Medi. If you just type in PA Medi, it'll take you right to the site. They have the ability to connect people directly with area agency on aging coordinators and PA Medi counselors throughout the Commonwealth of Pennsylvania. Another organization that's the sister organization to PA Medi is PA Link. And PA Link provides not only assistance in helping older Pennsylvanians getting connected with organizations like PA Medi and other resources, but they can also help individuals who are, individuals who are disabled, or individuals who are wrestling with substance abuse disorders. So PA Link is an incredibly resourceful way to connect people with the resources they need. In terms of an easy customer transition, and this is what it's really all about. Who is eligible for Medicaid? Basically, people who are age 65 or older, people who are younger than 65 who have a qualifying disability, or individuals who have end-stage renal disease or Lou Gehrig's disease. And again, to qualify, they have to be lawfully present, and they must live in the United States for at least 5 years in a row before applying for Medicare. Okay? A question you might get from a customer is, am I automatically enrolled at 65? Well, unless you're currently receiving Social Security or Railroad Retirement Board benefits, when you turn 65, you'll actually have to sign up for Medicare yourself or have somebody help you with it. Medicare may not notify that individual that they're eligible. So for a customer to be sure that their initial enrollment periods dates are met and that they're within that window, it's always best, again, to make sure that they know that they can get that information either through CMS or through an organization like PA Medi, and they'll be in good shape. A question that a customer might have is, during the initial enrollment period, what is that? Well, we mentioned just a couple minutes ago that initial enrollment period is centered around their 65th birthday, and you'll have 7 months total. You'll have the 3 months before your birthday month, and then the 3 months after. And that's something that we have examples of here. If you turn 65 on June 7th, your IEP will be from March 1st to September 30th. However, and again, there's that first day of the month birthday that could happen. The example is if you turn 65 on June 1, your IEP will be February 1st to August 31st. Now, a question that folks may have, and this is a common one, is, do I need Medicare if working past 65? If you're planning to continue to work past 65, you may be able to delay your enrollment in Medicare. If you have credible health coverage from your employer or are under a spouse's plan, you may qualify for special enrollment period and be able to delay enrolling without a penalty. Another question is, what happens if I miss my initial enrollment period? If you miss your initial enrollment period, Medicare offers a general enrollment period. That's a GEP for those who did not sign up around their 61st birthday or 65th birthday. That general enrollment period, again, is January 1 to March 31st every year. And basically, here's what you would need to know, or the customer would need to know to enroll. You can enroll in Medicare Part A, Part B, or both during this general enrollment period. Coverage begins July 1 of the same year. You may have to pay a late enrollment penalty. That's important. And you may be eligible to enroll in a Medicare Advantage, Part C, or Prescription Drug Part D plan April 1 to June 30th. And then here is a slide that basically walks people through some of the, how to enroll options with regard to original Medicare, Part A and B, Part C for Medicare Advantage. With that, you would enroll directly in the plan. Part D, you would enroll directly in the plan on the plan's website. And then the Medicare supplements, you always do that directly through the plan's website, through whoever the insurance carrier is. Again, some questions that might arise with customers transitioning from Pennie over into Medicare is they might have questions around their prescription drug needs, dental and vision. That's a big one, as well as if there's any help with costs when it comes to Medicare. Um, and another question that folks might have is, how do I change my coverage? Well, here's the thing to keep in mind. Just like Pennie, your Medicare coverage is not carved in stone. You have the ability to change that Medicare coverage every year during open enrollment. And that's something that a lot of people look forward to, being able to, make things right again. Again, just in terms of one last customer resource, I need to remind everybody that Pennie has a no wrong door policy here. We will do our best always to make sure that our customers get the protection that they need. And if we can help connect them to resources that help them better understand that transition from Pennie to Medicare, we're going to be here to help. So I mentioned to you that it was a packed schedule today. I do thank everybody for attending this lunch and learn session. I hope you found that there were a few pieces of information that were helpful for you. And with regard to the the program, thank you again. This is recorded, and we will be able to get it out to you. And Pamela had a question. There were actually a couple questions in the chat. I will try my best. There we go. First question. Please send slides. Kelly, I'll send the slides to you. Which slides? I will send you the presentation deck and a link for the video recording of this. All that are being presented, absolutely. Courtney had a question. Would PA consider aligning enrollment dates? It's really confusing. Here's the thing. That's an interesting question, Courtney. What I will say is this: when it comes to having Medicare enrollment begin October 15th and having the deadline on December 7th, that's not necessarily a bad thing. Why? Because it's a life event that is unlike any other people will have in the course of their life. It's a very important time. So having that separate open enrollment period for people transitioning over to Medicaid, it's not necessarily a bad thing. And Pamela Price, hi Pamela, does a person have to be eligible for Social Security to get Medicare? That's a good question. That's a very good question. Off the top of my head, I don't know, Pam, but I'll look into it for you. To what extent can an assister talk about Medicare? Yael, an assister can help people get connected with the appropriate resources. I would separate talking with individuals about Medicare resources and being an assister for Pennie. Okay. I say that because as a registered assister, you are technically focused in on helping individuals in the individual health insurance market here in Pennsylvania. Working with individuals who are transitioning into Medicare, it's important to be able to connect them with the right resources. So knowing about PA Medi, knowing about the resources available at CMS are incredibly important. And that would be my recommendation to you. Please familiarize yourself with those. Let's see here. Thanks, Scott. Okay. You best send the slides, and I will send the slides. I promise everyone. And yes, T has already said Scott will send the slides. Everybody, thank you so much. I know we're over time, and I apologize for that, but this was one of those very, very timely topics that came in that it's, like I said, it's something that's very near and dear to my heart because I like making sure that people, get to a better place and being able to connect them with the right resources related to Medicare provides them with a lot of good support. So with that being said, Thank you all so much. I hope you have a great week, and we will see you soon.